Good evening. You're listening to The Voice of Liberty, and this is your host, Ken Van Doren, and I have with me tonight Jake Towne, CD 15 Pennsylvania congressional candidate running as an independent, and we've mostly talked about the FDIC so far tonight, but we were going to get on health care. So why don't we switch tracks here at this point, Jake? Jake, excuse me. Have you been to any of the Tea Parties or health care forums that the congressmen are holding?
Yes, I went to a town hall that my congressman held last week. There was also a bus from D.C. that kind of drives through the area called Patients First, and they had a local rally in the area for privatized medicine. And I've actually gone to a few of the other, events in favor of the public option and talked to some of the folks involved with that as well. So I have
what's your take on the mood of the electorate on this, at least as represented at these town halls and things?
Well, our local town hall actually, I would say, brought out probably more people against it than in favor of it. There were several of each, but actually the ones that we had, it was basically people that were very worried about the government coming in and taking over their medicine and that type of thing. So I would say that overall, at least at the town hall that I was at, that's what the people's voice was. There was, people wanted to have debate, but what we found was that even the folks that were in favor of the public option didn't like certain things about it, because there were so many details, like I think they were going to stop offering privatized insurance contracts in 2013, and there's all types of just, like if you go through and read it, and I haven't read the whole thing, but most, certain parts of it, there's just many, many things that are controversial, even if you do happen to favor government intervention in terms of your health.
Yeah, I was at one yesterday in the 3rd Congressional District of Wisconsin, which is, it goes from the bottom of the northwest of the state along the Mississippi River down to the Illinois line. It's largely a rural district. The largest town in the whole district is only 50,000 people, and I think it's almost 200 miles north to south, so it's a huge chunk of territory. And we were in a small town of population 5,000, and as near as I could tell, the crowd seemed to be somewhere in the 55 to 60% against, and 45 down to 40% in favor. Roughly speaking, just judging from both of the representations of the speakers and from the response of the crowd, and I think that's pretty good. One thing I'd like you to comment on, there's been this accusation that there's an organized effort by the Republican Party and other special interests, the insurance companies, to get people to turn out. That's not what I'm seeing. What's your response to that?
Well, I mean, there is some of that. You can't say that there's none of it, but I would say that it's a little bit more basic than even that. I think that, in a lot of cases, at least with the people that I've talked to, this is kind of like the last straw to kind of get them to show up in person and go to an event. And a lot of folks are still coming out for the very first time. So, just that fact makes me think that, this organization type thing is just a bunch of nonsense by the mainstream media to a large extent, not all the way through. Go ahead.
No, well, I guess what I'm, to be sure, I called a few of my friends, and a couple of them showed up, and there's other people out there inviting folks and informing them. But I also had 3 different people send me this invitation from Obama that he's got this My Obama group, which is largely funded by the leftovers of his campaign, and you can bet the unions were out there beating the drums, and that's what I saw. Most of the people in favor appeared to be union members, judging by their T-shirts and other little hints that I got. A lot of them were public employees, which I guess they have their health insurance, but they seem to be socialistically inclined. But I think this accusation that it's so-called AstroTurf, I think that's nuts, because there's at least as much, if not more, my indications are a lot more organization to get the turnout from the left rather than from the right.
Yeah, I would agree with that. And they even had a poll at the last town hall that I was at, and with my competitor, the congressman, what he did was he decided to have the town hall in a rural area on the fringe of the district. So a lot of people actually drove 45 minutes to an hour, including myself, to actually show up at this rural spot. And about half the crowd actually drove that whole distance just to get there. And like I said, all the folks that I was talking to, like they just came on their own volition. Like they heard about the town halls, they might have seen some of the stuff on the TV, but at least at the ones that I've been at, like it was a pretty cordial event. People got to, not everybody obviously got to actually talk, but the people that did, there was a fair amount of logic used on both sides. I was actually very happy and pleased since about 3 people out of maybe 15 or so that spoke, they were actually just referring to the Constitution, which that was a bit surprising to me because a lot of folks actually aren't all that aware, but a lot of folks that did come out were saying, this is unconstitutional, it's not listed in the Constitution, you're not allowed to do it, period.
Well, I was the first speaker just by chance. It was a lottery, and I was the first speaker, and that was the first thing I said. We should be just addressing the Constitution. Is this authorized? No. End of discussion. But since we're going to talk about it anyway, can we afford it? That should be question number 2. And look at this nation. We are bankrupt. We're absolutely bankrupt. And you're wanting to add to the expenses? It's pure hogwash that you're going to create several, not one, but several new bureaucracies to handle the different facets of H.R. 3200, and you're going to expand coverage and have it cost less. These guys are on the moon.
Well, yeah, and what a lot of people don't realize is that for, I believe it's Medicare, but I believe Medicare actually has $85 trillion in unfunded liabilities. So that's not just total liabilities. That's unfunded liabilities over the next, 40 to 50 years, but the projections are actually by roughly 2017, so, roughly a decade out, the program will be no more. And it already runs at a loss, so you'd have to wonder, why would you want to have the government take over even more of the healthcare system? Why would you want
more of any facet of the economy, for that
absolutely.
matter? Yeah.
But, a lot of folks, they need to take a look at the root causes because, Medicare wasn't around forever. It started in about 1965. We had the HMO Act of 1973, which has really led to a lot of the loss of competition and also tying employers to plans and the federal government than ever before. So when people look at a lot of things, like I've been meeting with a lot of folks, and one of the things that I point out to them is that in 1986 there was this EMTALA Act passed. So
what act? Could you?
The EMTALA Act. I can't remember the whole acronym. It was like Emergency Medicine something or another. But in that, it's linked in my platform, which is on the website.
Okay.
But in that act, it basically stipulates that anyone that shows up because what I hear a lot is, the poor need to have health coverage. And I'm like, well, do we really want poor people to have coverage, or do we want them to have care? Because coverage is not the same as care. You can cover everyone, but if there's not enough care, it's all for naught.
Yeah.
But what this act did was it stipulates, and still in effect today, that if you show up to an emergency room, they have to treat you. It doesn't matter if you're insured or not. They have to give you care.
It doesn't even matter if you're a citizen or not. I mean, literally in the Southwest, there are ambulances crossing the border and dumping, pregnant women with complications off at emergency wards and things like that.
Oh, jeez.
There's at least a dozen hospitals along the Southwest border that have closed their emergency rooms because they're going bankrupt because of they're being overrun by illegal aliens.
Right.
And deadbeat Americans, let's be fair. There's a lot of deadbeat Americans, too, who use the emergency